Hello, I'm Annette Young and welcome to the 51% show about women reshaping our world coming up. As Taliban restrictions leave Afghan women without medical care after a deadly earthquake, we have a report from one rare hospital in Kabul where women are still able to access treatment. Also, at least 9 French families are suing the government over ignored pleas for help by victims of domestic violence. I'll be speaking shortly to psychologist Dr. Andreea Gruev-Vintila, a specialist in coercive control, on the need for authorities to change their approach. And is one of aviation's greatest ever mysteries about to be solved? A new expedition is seeking to find out what happened to American aviator Amelia Earhart, who vanished in 1937 while attempting to fly around the world. But we begin in Afghanistan, still reeling from a powerful earthquake in the east that killed at least 2,200 people and injured thousands more. The Taliban's ban on contact between unrelated men and women meant many women's injuries went untreated, with some even being left trapped under the rubble for days. It comes as women in Afghanistan can only be treated by female doctors and nurses, yet they are banned from attending medical and nursing schools. A France 2 team gained rare access to the French hospital in Kabul, one of the few places where women can still receive treatment.
It's the best hospital in Kabul. Here, doctors perform cutting-edge surgeries unseen anywhere else in Afghanistan. That day, a medical team arrived from France. Surgeon Anne-Marie Chartier is a volunteer for the NGO The Chain of Hope. She came to train her female counterparts. In Afghanistan, only women are allowed to treat women.
Alors, first we have to do a little dissection.
They are still allowed to work, but for the past 2 years, no new women have been able to become doctors.
Unfortunately, I see in the last generation in the specialty of doctors, there is no other new generation, and we're proud, we're happy.
They're motivated and they'll go on to train others, but that means they have to really learn the procedure and work hard. Knowledge is their best weapon.
The Taliban raised their flag over Kabul 4 years ago. Since then, they've kept tightening their grip on women, going as far as banning them from training in the healthcare sector. This medical school was founded 10 years ago to train women as midwives and nurses. Now, the library is empty.
Everything is closed. Everything is closed now. They have completed it.
More than 1,000 women used to study here every year. These training rooms are now deserted.
It is heartbreaking. Everyone knows it. This is a crisis coming to Afghanistan in the near future. If we do not have these girls, and all the services will have to be provided by men in a country where most of the people are not allowing their women to go to males.
What's more, an increasing number of healthcare workers are fleeing the country. We've obtained a rare interview with a doctor and his daughter. Speaking puts them at risk, so we cannot show their faces. This 11-year-old girl is no longer allowed to go to school.
I have nothing to do at home. I miss school. I think about it all the time. One time I got really upset about the Taliban ban. My mum told me to calm down. It's so unfair.
Her father dreamed she would follow his footsteps and become a doctor. He's made up his mind. They'll both run away at the earliest opportunity.
As a father, as an educated father, as a doctor father, I am not able to facilitate them. This is make me angry and stressful.
But fleeing abroad is risky. The Taliban have eyes everywhere. Even the French hospital is guarded 24/7. Each year, more than 5,000 patients undergo surgery here, but the future of the hospital and its patients remains uncertain.
Here in France, at least 9 families who've lost a family member to domestic violence are suing the government, accusing authorities of ignoring pleas for help. In June, the state was ordered to pay €27,000 to the family of Nathalie Dubaye, who was killed by her ex-partner in 2019. This after multiple warnings by Nathalie to the police. Last year, 140 women were killed by partners or ex-partners in France, up from 94 in 2023, with the country's rate slightly above the EU average. By this month, there's already been 108 femicides in France. So why are authorities failing victims and their families? With me in the studio is Dr. Andreea Gruev-Vintila, a specialist in social psychology at the Paris-Nanterre University, who's also written a book entitled Coercive Control at the Heart of Domestic Violence. Thank you so much for your time, Andreea. Do you understand why these families have taken this step?
We should acknowledge that oftentimes the police, the gendarmerie, or even courts have a rather fragmented approach to domestic violence. Coercive control is a way of understanding domestic violence and that which the victim experiences as a course of conduct made of many facts, many incidents, many behaviors that most of victims had already reported to the police when they have been failed. This means that their time is managed by their abuser, their money is managed, their resources, their everyday schedule, their children's schedule. So all of these form a cage around the victims, and when they try to escape, that's when the control, the coercion, and eventually violence increases. In fact, we know that in 1/3 of femicide cases, physical violence is present. In all of the other cases, instead, coercive control is present.
And just to explain, coercive control is not, as you point out, just physical violence. It's control over the woman's money, her movements, who she's seeing, and so on, isn't it?
In some cases, we even see control over her possibility to access the refrigerator, her possibility to take the kids to certain activities, her deprivation of sleep. So all of these are means of control on someone's life that were identified already in Korean camps against the prisoners of war. It took us 50 years to understand that domestic abusers use the same tactics against women and children in their very own home.
When you look at those figures that I've just cited, here we are in 2025 and the number of femicides is on the rise this year compared to previous years. What does it say about the value or the worth of women in our society?
Well, it definitely says that we should listen to the victims. We should listen to how they experience violence and translate their experience of domestic abuse in law, and not to keep our current offenses, which are clearly insufficient to both protect victims, but also to prosecute and convict these abusers, and also to prevent violence. So this is why we wrote a law that was adopted at the National Assembly, in which coercive control is at the core of domestic violence as a course of conduct that should be recognized by law. One of the reasons for which I stand with the families, victims that you mentioned in the beginning, is that it clearly shows that we should have in France a comprehensive approach of domestic violence, including at the state level. This means the law.
So what needs to be done immediately?
We need the law on coercive control to be adopted. The system that is supposed to protect the women and the children fails because our professionals have a wrong understanding of that which domestic violence is. It's not just physical violence, it's not just offenses here and there, like incidents. It's a course of conduct that progressively entraps women and children in a glass cage. And this glass cage is something that the victims do experience, but we as third parties miss, which is precisely why we should listen to the alerts that women, like those that you mentioned in the beginning of the interview, and many, many others, because we're talking about 250,000 women victims of domestic violence. We should understand these red flags not just as small alerts, but as huge red flags, because coercive control is the precursor to most femicides and most child homicides in the context of domestic violence.
Andreea, thank you so much for coming in.
Thank you.
And one of the greatest mysteries in the history of aviation could soon be solved. Amelia Earhart, the first woman to fly across the Atlantic, disappeared in 1937 while attempting to fly around the world. A new expedition is now seeking to find out what really happened.
She vanished 88 years ago. No one knows what truly happened on the 2nd of July 1937, when Amelia Earhart disappeared over the Pacific. The aviation pioneer and her navigator were on their final leg of a world tour. That day, they took off from Papua New Guinea. To reach California, they needed to refuel on Howland Island, a speck in the middle of the ocean. That's where their trail went cold. But today, fresh clues have reignited the search. A satellite image taken in 2020 shows a wreckage hidden on a remote Pacific island. Perhaps Amelia Earhart's missing plane.
The size of the dry object matches perfectly with the size of the Electra. Amelia was planning to be rescued, refueled, take off again.
This is the story of a legacy. It's the story of a mystery. We hope it will ultimately be the story of discovery, and even perhaps one day the story of a special homecoming.
Historians will launch a new expedition in November, hoping to find out more about the circumstances of her death. Amelia Earhart, one of the first female aviators in history, was also a feminist icon. She received a hero's welcome after her first Atlantic crossing. Since her death, dozens of expeditions have failed to find her, but this year's mission could finally solve one of the greatest mysteries of the 20th century.
And that's it for this edition. So until our next show, bye for now. Okay.